The point that Julia talked about was, I love her hugs method, the humor, because humor really is a good type of medicine. I mean, hearing those stories about how she got the attention of the nurses and things like that, that was good to hear.
Her book and her talk transverses disciplines, and can really support people in every walk of life.
I think that the whole positive outlook and the fact that we make our own choices about being positive is what I've embraced. And I think that that's something that I try and teach my patients as well, that they have a choice about how they handle things. They have a choice about how they decide to move forward in their lives. And they don't have to succumb to their circumstances. They can decide what they want to do going forward.
I encourage not only other patients, other people like her, but also professionals like OTs, speech therapists, PTs, anyone like that, just to hear from the client's perspective, to really know what's going on.
Well, I think occupational therapy is meant to be holistic. We're meant to look at all the dynamics of a person's life, and attitude is certainly a part of that. And I think that one of the things that Julia talked about in her book a lot was the focus not always being on what was important to her. And I think that that's something that we as occupational therapists are always striving to do. We're always trying as OT practitioners to look at what is the patient's goal, what is it that they're trying to achieve. And if it's not that they want to be able to lift their arm over their shoulder, but they want to be able to fasten their undergarments, then that's what we need to focus on, not necessarily meeting some sort of predestined criteria for range of motion, but actually getting to the occupations that are important to them.
It was from the client perspective, and it really speaks to the OT profession, and it was so inspiring to hear her words of wisdom and her story.